Welcome to Turning the Tide, New Directions in Health Communication. Building off of our success from last year, we're holding our second Turning the Tide conference.
The tide will be turned by the outcomes of the conference, but also by unifying our thinking together to have ever greater impact.
Is health communication this enormous tidal wave of change? First and foremost, it's grounded in evidence. It's strategic, it's theoretical, and it does involve creativity, and that's an intentional word. This idea that there is, the idea of connecting with people and telling stories and all of these things that really make it much more effective.
Communication is more about listening than it is about talking. And if you're in a situation where you're just throwing balls over people's heads to the sides and they're not catching it, you're actually not communicating.
If we care about changing the environments in which people live and transforming those environments so they foster health instead of injury and disease, then we have to pay attention to how those environments got that way, how we can change them.
Data visualizations are usually composed of some sort of container, right? And then the content. As part of that content, we use a visual encoding, which is a method of representing the data, and then we also add written or verbal annotations to the data that is being shown to us.
The larger point I want to make here is this. This is one of my favorite quotes. We need to design for the way people are, not the way we wish they were. People only remember one thing from a given visual. If we're intentional, we can choose to use the context cues that we have available to us to create the one message, right? What do they need to do what they need to do with that data?
I just want to tell everybody thank you so much for coming today. This is our second conference and it's been wonderful. Thank you so much.